Welcome to Whiteboard Wednesdays. This is where we look at some of the trickier questions you might have when it comes to finance, and then we draw. Okay, I'm not going to make the drawing pun again. I guess I kind of did. Anyway, I'm Taylor Blackburn. I'm a personal finance specialist here at Finder. Now today, we're looking at health insurance. We're going to whiz through some of the stats about health insurance and also talk about how much it costs. Do you need it? Is it worth it? So currently there are 13.5 million Australians that have private health insurance. Now before we jump into more numbers, let's just stop and explain what private health care is and if you need it. First up, most Aussies don't need to have private health insurance. In Australia, we're lucky enough to have Medicare, which is our universal healthcare scheme, which provides Aussies with healthcare for free or for a low cost. Now, private health insurance is considered a luxury, much more than it is considered an essential. Having said that, around 11 million of us have what's called hospital insurance, which means you can skip long waiting queues in the public system, choose your own hospital or surgeon, and enjoy a private room. Also, if you have to call an ambulance for any reason, this is going to save you a lot. In all but 2 states, you have to pay out of pocket for an ambo ride, and it can cost $900 just to get them to your door. Then you've got extras. That reduces the cost of more routine healthcare like the dentist, optometrist, physio, chiro, even massages. These hands are massaging. Some of the most popular extras that are used are dental, optical, and physio. So now around 13.5 million of us have extras. There you have it there. So they're a bit like the more fun and popular younger brother. And as the youngest of 3 brothers, I can relate. So how much does it all cost? Well, it really depends. Hospital insurance can cost anywhere from $60 to $200 a month, depending on which level you get. Level, you say? What levels are there? Funny you should ask. So there are 4: basic, bronze, silver, and gold. We've drawn them up here almost like planets that are different sizes. Now, these things all cover different treatments, amounts of treatment, and cover you for more or less, depending on how much you spend. Now remember, even if you have insurance, your treatment might not be totally free. If your private doctor charges more than a public doctor would, you have to pay that difference. It's known as the gap fee, and depending on the treatment, it can still run into the thousands of dollars. The extras cover, on the other hand, is much cheaper. It starts around $15 a month and can go up to $100 a month if you've got the platinum level. Now, it doesn't always cover the full bill. When you're going to the dentist, a lot of times it'll cover the cleaning, but if you go to the physio, you might still have to pay $50 out of pocket. So is it worth it? Well, that's the billion-dollar question. In some cases, absolutely yes. If you earn more than $90,000 a year, you should get a basic hospital policy at the very least. Just right now, go get it. Why? That's because if you're in that income bracket, you get hit with an extra tax called the Medicare levy surcharge. But you can avoid it by having hospital insurance. And there are plenty of policies out there which are actually cheaper than the tax, so it's a no-brainer. Now, when it comes to extras, if you go to the dentist twice a year, a starter policy would be more than paid for. Aside from that, it's up to you to figure out whether you want to pay for the convenience. It's like skipping the queue at a theme park, you know? Some people don't mind waiting, but it's nice to jump right to the front of the line, especially if you've had one too many Dagwood dogs. Okay, last one, stay with me. It's about those penalties I mentioned. Now, this one is new, and it's called the lifetime health cover loading. Now, basically, if you don't get hospital insurance while you're young, you have to pay more for it when you're older. So to avoid the extra cost, you have to get cover before the 1st of July, immediately following your 31st birthday. If you don't, they'll charge you 2% extra for every year over the age of 30 you don't have cover. Wait until you're 40 to get insurance and you'll pay 20% more. Wait until you're 50 and you'll pay 40% more, and so on. So people choose to buy a cheap policy earlier in life, so when they get old and are actually more likely to want that high level of cover, they won't be paying through the nose for it. It's worth thinking about. And speaking of noses, elective surgery can be covered by private insurance. So I think I've covered the big stuff, but if you want to know more, click the link in the description below. If your question is good enough, we might even make another video. What's that? No, I'm being told we will not be making another video. If you've managed to make it this far through a video about insurance, you're probably going to love our other videos. So hit subscribe right here for more confusing finance stuff made easy. We've collated this information from the Finder Insights team. To see more data, check out the details below. If you have any questions, don't forget to tweet us with the hashtag FinderWhiteboardWednesday. I'll see you in health,